Hi, my name is Haley Oliver, and I'm the director of the USAID Feed the Future Food Safety Innovation Lab. And we are so pleased that you've joined us today for our series of 2 webinars that are based on risk-based approaches to food safety. As we move through the webinar, I'd like to draw your attention to some of the features of the webinar. We encourage you to ask questions using the Q&A feature located at the bottom of the screen. There's also a closed caption function that's available should you choose to use it, also located at the bottom of the screen. I couldn't be more excited to welcome our distinguished speakers here today to talk to us about risk-based approaches in food safety. Risk-based approaches in food safety are widely recognized as valuable tools to prioritize the allocation of limited resources for food safety research, outreach, and policy. They help food safety authorities, private businesses, NGOs, and other stakeholders create a roadmap for strengthening food safety practices and policies. What sets them apart is their use of data-driven, transparent processes to identify, assess, prioritize, and manage food safety risks. Risk assessment is quite adaptable and scalable, from setting high-level national priorities to addressing specific risks in food businesses or value chains. It's my pleasure to introduce our first speaker, Dr. Ari Havalar, who is a preeminent professor of global food safety and zoonosis in the Animal Sciences Department, the Emerging Pathogens Institute, and the Global Food Systems Institute of the University of Florida. His research focuses on epidemiology and risk assessment of food and zoonotic diseases and their prevention in the USA and globally. He has published extensively on the global burden of foodborne disease and currently serves as a consultant to the World Health Organization to support the process of updating burden of disease estimates. He contributes to the Feed the Future Innovation Lab for Livestock Systems, leads the Campylobacter Genetics and Environmental Enteric Dysfunction Project, and participates in several other projects focusing on food safety and zoonotic infections in low and middle income countries. We welcome you, Ari.
Good morning, good afternoon, good evening, wherever you are in the world. Welcome to this presentation on microbial risk assessment in low and middle income countries, where I'll talk about some of the challenges that we have encountered in recent projects and some of the solutions that we have come up with to overcome these challenges. My name is Ari Havalar. I'm with the University of Florida and participating in several projects on food safety in low and middle income countries that I'll discuss somewhat later, including a project funded by the Food Safety Innovation Lab. So to structure this talk, I'll be talking about 2 types of microbial risk assessment, the top-down approach and the bottom-up approach. The top-down approach starts by considering data on human illness from surveillance systems, from outbreaks, from epidemiological studies, and then tries to attribute these cases of illness to sources, food or other vehicles that may have carried the pathogens to the host who then got ill. In the US, you would say the CDC approach. This is a retrospective approach. Obviously, you can only apply this approach when cases of illness have occurred. You can try to look back, but a lot of things may have happened between finding out that people have become ill and the actual exposure to the illness. So there is a time gap, and there's the problem that you cannot really predict what will happen in the future. The second approach, the bottom-up approach, considers the occurrence and the dynamics of pathogens in food chains. Where do the pathogens enter the food chains? Where do they multiply? Where do they die off? What are control points? And then tries to model all of that to human exposure estimates, combine that with dose response models to estimate the illness risk. It's often a data and resources and intensive exercise, but it has the benefits that it's predictive. So you can, by changing some of the parameters in the computer model, try to predict what happens in future when situations might change. For example, when there has been an intervention or when some of the conditions in which the food is being prepared are changing. For example, think about climate change, the impact of temperature on many of these pathogens in food chains. Both methods have their biases. And if it is possible, combining those two approaches may be efficient and may add to the precision of the estimates. So let's talk about some of the limitations. In the bottom-up approach, we have the familiar steps, starting with a statement of purpose and then going to hazard identification, exposure assessment, hazard characterization, and risk characterization. I'll talk briefly today about limitations in the exposure assessment related to the informal food chains in many low and middle income countries and the lack of data, even fewer data than in many high income countries. And I'll also talk about a special aspect related to risk characterization, which is repeated exposures. We know that exposure to pathogens is much more common in low and middle income countries than in high income countries, and that needs to be accounted for. In the top-down approach, I'll talk about the World Health Organization data, estimated by the Foodborne Disease Burden Epidemiology Reference Group, published in 2015, as the basis for estimating what the magnitude of the foodborne disease problem in countries around the world is. The limitations of those data are that they have only been presented at the sub-regional level, not at the country level, and also that the reference year is 2010, so by now these estimates are quite outdated. We'll then, of course, go to attributing those illnesses to food, and then to make it more informative for decision makers, we try to attribute to food groups and specific foods. And again, there's very limited data, and I'll talk about some of the approaches we took to overcome those data limitations. So first of all, the informal food chains. What has been done, I'll discuss an example of work done in the PUSH project by ILRI and partners, is to do value chain assessments to map food chain structures and product flows. There is a diagram in this slide that we can advance. Here you can see the outcome of a lot of interviews that the researchers had with different actors in the food chain, starting at the primary producers, then looking at wholesalers, retailers, and ultimately different types of consumers. And every actor in that food chain will provide some information about how they obtain their product, from which previous steps in the food chain they obtain their product, whom they sell to, and also quantitative information like what proportion of their product is sold, for example, to medium retailers, smaller retailers, and what proportion is sold to private consumers or restaurants or street vendors, etc. So this kind of approach will give you snapshots of the structure of the food chain and the product flows through the food chain, but it will not directly give you a full identification of how the product flows through the food chain. So what Claudia Genser in my lab, in the next slide, has done together with Gary Barker, specialized in Bayesian belief networks, is to try and integrate all of that information in a Bayesian belief network where you can make joint estimates of probabilities from limited sets of information. This is an example for the tomato chain in Burkina Faso. That's why I have this picture of tomatoes in my background. And you can see there are 4 levels of the food chain: the producers, the wholesalers, or the traders, the retailers, and the consumers. And using this network, you can at every point in the food chain estimate what proportion of the food product at that stage, at that particular actor, has been traveling through this food chain according to all of these arrows. And what is more, we also were able to add impact of damage of tomatoes. One of the main reasons why there are safety problems with tomatoes in low and middle income countries, that they become damaged and the flesh becomes available for microbial growth. It also leads to food loss. And you can see in the right-hand blocks that we were able to quantify the amount of food loss that's accumulating throughout those stages, and also the amount of damage that's accumulating throughout those stages. So that you can also include quality data. And if we then have data on the prevalence and numbers of pathogens in damaged and non-damaged tomatoes, we have a very strong backbone to start building quantitative risk assessment models. So now moving towards challenges in data collection. One of the main limitations is that there is a limited laboratory infrastructure and training in many countries, in low and middle income countries, and particularly lack of familiarity and training in molecular methods. A second problem related to the laboratory infrastructure is that reagents for laboratory work are often difficult to get in low middle income countries, typically require hard currency to be bought. In projects, typically a lot will be bought, for example, in the United States and then shipped to the partner countries. But increasingly import and export requirements are becoming more stringent, and there are more and more paperwork to be filled. So this limits at least the speed, but also the availability of reagents. So overcoming these limited availability of laboratory supplies in country becomes increasingly difficult, even if the money is available. Then there is the problem that most of this work is going on in projects, and projects are projects. So at some point they end, and the sustainability of capacity building efforts that was done in this project is problematic. There's a lot of investment in personal capacity in equipping laboratories, but if the projects are not continuous, then it may be difficult to maintain the outcomes of that effort. So what are some solutions that you can think of? In a risk assessment framework, obviously the first and the cheapest solution is to borrow data from high-income countries, which may or may not be appropriate. A second step that doesn't require a lot of laboratory infrastructure is to use expert elicitation, ask experts in the country for most likely estimates and the uncertainty around most likely estimates for parameters that are needed. Obviously, the data that the experts have are limited, so the reliability may be low, the uncertainty may be high, but at least it's a step forward, and using then sensitivity analysis, it will be possible to identify those data gaps that are most important for the final outcomes. More involved approaches, of course, include project-based capacity building, strategic sampling and analysis. And I think a lot more needs to be done related to study design and advanced data analytics in these projects to make maximum use of the available resources. To overcome the gaps between projects, it is important to think about long-term investments in institutional partnerships, both from research institutions, but also from funders and governments, to try and create that continuity that is so important. And of course, these days, everything is done against the background of decolonizing science, trying to get actors in the target countries to be more involved in writing grants, developing projects, not only in executing the projects. And one thing that I think is also incredibly important is open access publishing, so that data that are generated are becoming available. More and more funders require open access funding, but there is little attention until now for the fact that because open access funding always requires a certain fee, it may not be possible for investigators in lower middle income countries to publish open access. So those who would benefit most from it have least opportunity to publish. There are private funders like the Bill and Melinda Gates Foundation, the Wellcome Trust, who will allow who will fund open access publishing even beyond the term of a project. And I think many funders should be considering very carefully how they can support open access publishing as a continuous activity within their grant portfolios. Some more technical aspects now related to what I mentioned, the advanced study design and data analytics. The prevalence of salmonella and other pathogens in tomatoes often is very low, 0.1%, 1%, or even lower. So if you have limited resources, testing, say, 100 tomatoes may not really give you a lot of positive results. So one thing we did in the framework of the Push project is to work on strategies to look at pooling of tomatoes. These graphics show the probability of finding a positive result if there is a certain pool size. And you can see that depending on the prevalence, the probability of positive results can be very low up until very high. And plots like these will help you select the optimal pool size for different types of products. For example, if you have intact tomatoes, the expected prevalence is very low, and we chose to have pools of 30 tomatoes. If they are damaged, the expected prevalence is higher, and there we decided to take a pool of 10 tomatoes. So simulating and analyzing the sampling strategies beforehand will give you a much better return on the amount of work that you can do in the laboratory. A next example is about repeated exposures. As I said, exposures in low and middle income countries are much more frequent, and they will generate some level of acquired immunity. And that means that the basic assumption that many risk assessment models make, that every exposure is independent of a previous exposure, is violated. We have to take into account the frequency of exposures and also the intensity of the exposures. We can do that by combining standard QMRA models with dynamic infectious disease models, the type of models that have been used to model, for example, the COVID pandemic, where repeated exposures are sort of easily encountered. This is an example from a paper that I published with Arno Zwart, a collaborator from the Netherlands in 2014, where you can see that there is what we call then an inflation factor, a correction factor for the naive risk estimate that every exposure is independent, that varies from relatively small, between 1 and 0.5 for annual exposures, but very quickly drops off to very high levels of correction when exposures are daily or weekly. So there are methods to take the acquired immunity in low and middle income countries into account. Unfortunately, the data to parameterize such models are still relatively sparse. I'll now move to the top-down approach, starting with the WSO FERC data. I mentioned they are only available at the sub-regional level. We have successfully been working with the governments in Ethiopia, Burkina Faso, and Rwanda, and got their approval to access and publish data specifically for their countries, and also share them with them so that they could use them for their own decision making. We've also been looking at the global burden of disease study that produces estimates of the global burden of disease, including many of the pathogens of importance for food annually. So we've been able to use trends in the GBD data to update the FERC estimates. WHO has now launched the initiative to estimate the global burden of foodborne diseases, and their plan is that by the end of 2025, they will publish updated estimates, and these estimates will be at country level and at a rolling annual basis. So hopefully in future, these limitations will be overcome and there will be one consistent data source from WHO. The next step is then the attribution to food groups and food products. Again, an example from the Tatar and Push projects in these three countries, Rwanda, Burkina Faso, and Ethiopia, where the interest was in products like beef, dairy, vegetables, specifically tomatoes, and poultry. And the need for attribution was at a much more detailed level. FERC has produced attribution estimates for Salmonella and Campylobacter at the food group level, so poultry, eggs, beef, etc. For these projects, we wanted to zoom in more. We also wanted to attribute enteropathogenic or enterotoxigenic E. coli, for which there were no estimates. So we set up country-specific structured expert elicitation studies to provide these additional data. And the tree map that you see here is one that was created for Ethiopia, for Salmonella. And you can see by the size of these rectangles what proportion of all foodborne cases was attributed to the major food groups, the different colors. And then within those food groups, for example, in the poultry meat group, poultry meat consumed out of the home or produced inside the home and then bought slaughtered or bought as an intact live chicken and slaughtered at home. So these elicitations can be adjusted to the needs of projects, and they do take time to perform, but they're a very rich source of data. This is an example of results for the disease burden of dairy products in Rwanda, where we attributed 5 different pathogens to dairy overall. You can see here that the burden of Mycobacterium bovis in disability adjusted slightly was higher than of any of the other pathogens, but there were also important contributions from Salmonella and from Campylobacter. Also note that the burden of Brucella, that often gets a lot of attention for dairy, was relatively small, as was the burden of Cryptosporidium species. The second table, when you compare the top and the bottom table, you see that approximately half of the burden of dairy was attributed to raw milk. The experts also attributed quite a burden to processed milk, industrially or traditionally processed milk, because they were of the opinion that current processing methods were inadequate to inactivate all pathogens, and there were also major risks of recontamination. So our advice to the government of Rwanda was that promoting the use of processed milk rather than drinking raw milk might result in a considerable reduction of disease burden, but only if that would be accompanied by measures to improve the safety of processing and avoid recontamination. So in conclusion, I hope that these examples have given you some idea of the lack of the challenges of doing quantitative microbial risk assessment in low and middle income countries. Also some of the solutions that have been tried in the framework of the 3 projects that I mentioned, the Pupus project, the Tartar project, and the Chikula Salama project, funded by the Bill and Melinda Gates Foundation, the UK Forum, the Commonwealth Development Office, and the Feed the Future Food Safety Innovation Lab. And I'd like to thank my colleagues Amanda Sepp, Claudia Ganser, Minna Amaya, Natia Singh, and Arno Swart for substantial inputs in the work that I was able to present here. Thank you for your attention.
Thank you, Ari, for highlighting the power of risk assessment, but also some of the challenges and the inputs that are needed for this tool to be really effective. It's my pleasure to introduce Dr. Joanna Zablotsky-Kufel. She is the Director of the Risk Assessment and Analytics Staff in the Office of Public Health Science at the United States Department of Agriculture's Food Safety and Inspection Service, which is the public health regulatory agency responsible for ensuring the safety of meat, poultry, and processed eggs. The Risk Assessment and Analytics staff conduct scientific risk assessments and develop new analytic methods for assessing risks of biological and chemical hazards in regulated products, which informs regulatory management options to support the Food Safety and Inspection Service's mission. Dr. Zablotsky-Kufel received both her Master of Public Health and PhD from the Johns Hopkins Bloomberg School of Public Health. Welcome, Joanna.
So hello, my name is Joanna Zablotsky-Kufel, and I work in the Food Safety and Inspection Service in the U.S. Department of Agriculture. First off, I want to thank you all for the invitation to speak to this group. I'm thrilled to share a bit more about my agency and the work that we do. Today, I'm going to talk about risk assessment. I lead the risk assessment and analytics staff and oversee all analyses and activities associated with microbiological quantitative risk assessment for FSIS. Just a little bit about me before I launch. I have worked for FSIS for about 14 years, and I'm going on 5 years of as being the director of this staff. So let's get started. This is a mission for FSIS. You'll note that we only regulate meat, poultry, and processed egg products. U.S. Food and Drug Administration is responsible for regulating all other foods. And our vision is really that everyone's food is safe. which is an extension of the Secretary's vision for the entire department. As you can see from these numbers, we do a lot. We inspect over 162 million head of livestock, 9.7 billion poultry carcasses, 2.8 billion pounds of liquid, frozen, and dried egg products, and our inspectors conduct 7.6 million food safety procedures every year. It's important to note here that FSIS is a data-driven agency. We analyze the data we collect and we use it to support our decisions. Speaking of data, as I said, we collect a lot of it. In fiscal year 22, FSIS laboratories comprised of over 210 employees analyzed nearly 135,000 samples. Those samples were then used to perform upwards of 750,000 tests. And those tests resulted in 2.3 million results being reported for use in inspection and decision-making. The major reasons we conduct sampling at FSIS are to respond to public health concerns and foodborne illness outbreaks, to verify product meets regulatory requirements, and to verify the adequacy of the HACCP systems in establishments. Our sampling programs have life cycles that drive our priorities. We use these sampling programs to make data-driven decisions to improve public health, to inform agency decisions, and to refine policy. FSIS consists of 11 program areas. I've highlighted in the slide the primary players for our risk assessment work: OPHS, OPPT, and OFO. My staff sits in the Office of Public Health Science, or OPHS. We have 3 headquarters staffs, meaning that we're all in DC, or at least based in DC, and we have 3 field service laboratories. My staff is comprised of 11 experts from a wide variety of disciplines: epidemiology, mathematics, statisticians, veterinarians, economists, just to name a few. We work very closely with our Office of Policy, or OPPD, as they are responsible for identifying risk management options and questions, as well as conducting cost-benefit analyses. Our field operation folks are really the backbone of our agency. They are the most significant portion of our actual workforce, and they are in slaughter and processing facilities nearly every single day, conducting inspections and taking microbiological and chemical residue samples, among many other tasks. So risk analysis is the cornerstone of both national and international food safety programs. It allows us as a federal agency to make science-based and data-driven food safety decisions in a transparent way, while also allowing for stakeholder input into the process. With risk assessments, we can answer questions like how many salmonella illnesses might be avoided by implementing a different performance standard. And you'll hear a lot more about that at the end of the talk. This slide is a bit busy, but the key point here is that not only is risk assessment an important tool for decision-making, as I think I've said many, many times at this point, but it is required based on Executive Order 12866, as well as other national and international acts and agreements. And I've listed those here for your information. And it's important to note that FSIS uses risk assessment as a decision support tool. It allows us to compare the effectiveness of interventions, to optimize inspections, to mitigate the greatest risk, and it allows us to evaluate standards to achieve food safety objectives. Further, the risk assessments we conduct are fit for purpose, meaning we only include the structure and complexity necessary to address the risk management questions being asked. So how do we reduce foodborne salmonella illnesses? As you may have heard in the news, FSIS is pursuing a robust and pretty significant effort to reduce salmonella illnesses from poultry. We announced in October this framework in October of 2021, and I'm going to talk a little bit in the next couple of slides about this new framework. So FSIS is pursuing this approach because we know salmonella is a real issue. There are over 1 million cases of salmonella from all foods annually, and that FSIS regulated products are the source of many of those infections. In fact, the Interagency Food Safety Analytics Collaboration, or IFSAC, which I'm a FSIS steering committee member of, estimates that 23% of foodborne salmonella illnesses are attributable to poultry consumption, over 17% from chicken and almost 6% from turkey. As announced publicly, FSI is considering 3 major strategies to target salmonella at pre-harvest, within process control, and with enforceable final product standards. And I've included a QR code here and a link so you can read more about the entire framework. In our pursuit of this framework, we needed to gather significant scientific evidence. So we did a number of different things. We provided NACMA for the National Advisory Committee on Microbiological Criteria for Foods with the charge to see what types of microbiological criteria or salmonella performance standards, put another way, might the agency use to encourage reductions in salmonella in poultry products so that they are more effective in preventing human salmonella infections. We conducted an extensive risk profile of pathogenic salmonella subtypes in poultry, and that was externally peer-reviewed. We are conducting 2 quantitative microbial risk assessments, one for chicken and one for turkey that I'll talk a bit more about. And we expanded our sampling to include salmonella enumeration of specific poultry products. So a bit more about the risk assessments. While my staff has played a role in nearly all of these activities, we have been most focused on the design and conduct of these 2 risk assessments. As I said, we have 2 quantitative probabilistic food safety risk assessments looking at both chicken and turkey, and we're looking at carcasses, parts, and comminuted products for both of those products. These risk assessments are being used as a decision support tool to help guide agency regulatory decisions. We've not done this alone, of course. We have engaged in a cooperative agreement with the University of Maryland to enhance data sharing between ourselves and the industry. And we've engaged with Epix Analytics to develop innovative tools to group salmonella serotypes by virulence. So this is just a snapshot from our exploratory sampling efforts. You'll note that we tested samples at the start of the slaughter process, or rehang, and then at the end of the process, which is called post-chill. And in this slide, we looked to see whether there was concurrence between serotypes found at each location. And this is just a snapshot, like I said, of multiple different types of sampling and analyses we've done. Another major step the agency has taken was to propose a new notice of determination to declare salmonella an adulterant in not ready to eat breaded and stuffed chicken products. And I've again provided the link in the QR code here if folks want to read more about it. In the coming year, we also intend to announce additional proposed rules, which are going to be supported by the risk assessments and all the other scientific endeavors I've mentioned here today. So to close us out, I simply wanted to showcase the many ways FSI has utilized QMRA for salmonella to evaluate controls, to optimize inspection, and inform performance standards over the years. Our recent effort with the salmonella framework is certainly a large endeavor, but it's certainly not the first time we've looked at salmonella in a variety of regulated products. And finally, I wanted to highlight the many ways we communicate, engage, and collaborate with a variety of stakeholders. We maintain a robust webpage with many of the risk assessments we've conducted over the years. My staff has also published extensively in the scientific literature, and we maintain a list of those publications on our webpage as well. We've shared information about our work with stakeholders and academic partners like yourselves, and we participate in many interagency collaborations with IRAC, the Interagency Risk Assessment Consortium, IFSAC, as I mentioned before, and we do a lot of work with our sister agency within the department, the Agricultural Research Service. And then finally, we participate in many other collaborations with external partners, like I mentioned with the University of Maryland and Epix Analytics. So that concludes my talk. Thank you very much for your time and attention, and I'm happy to answer any questions you might have.
Thank you, Joanna, and for sharing how the USDA Food Safety Inspection Services uses a data-driven approach to inform policies that ultimately protect public health, and for your leadership in this space. It's my pleasure to introduce our third presenter, Juliana Ruzante, who is a research public health analyst at RTI International's Center for Health and Environmental Monitoring. She is a public health veterinarian with over 20 years of expertise in food safety and the epidemiology of foodborne diseases. She has extensive experience working with data from foodborne surveillance systems in the United States to support the development of evidence-based policies and practices to prevent foodborne disease. Dr. Ruzante was also key in developing a multi-criteria risk ranking framework that has been considered by several government agencies as a mechanism to prioritize foodborne pathogens. She has served on several advisory committees, including the National Advisory Committee on the Microbial Criterions for Food, the Food and Drug Administration's Food Advisory Committee, and expert meetings organized by the National Academies, the FAO, and the World Health Organization. Welcome, Juliana.
Okay, good morning, everyone. Thank you for inviting me. It's a pleasure to join this webinar. My name is Juliana Rosante, and I work for RTI International. For those that do not know about RTI, we are a research nonprofit, and we work on several issues across the globe. Food safety and risk is one of the things we do. And my talk today will focus on prioritization of food safety risks and decision-making. As the speakers before me likely mentioned, there are three components of risk analysis. Risk assessment represents the science portion of the risk analysis, being quantifying the diseases, estimating the public health impact, measuring the impact of interventions. That's extremely important as part of this process. And then there is the risk management that uses the input from the risk assessment to then make the policy decisions. And at that point, risk managers might incorporate other factors beyond public health to arrive to those decisions, to the policy making. So I will be focusing on that risk management and decision making for the rest of my talk. So just keep in mind this risk analysis framework. So risk management decisions are complex. They are multifactorial process, and they might consider, again, as I mentioned, other factors beyond public health. We all work on public health. We want to reduce the burden of disease in our communities, but there is a need for sound choices to address the public health risks in light of economic, social, environmental, and political impacts. And here's a quote from FAO guide on risk analysis, acknowledging this multifactorial aspect of the risk management. Here's another familiar framework for risk management developed by FAO and WHO, where risk ranking and prioritization are identified as part of the components of the risk management process. The risk managers, they review, they compare current food safety issues on regular basis in order to identify priorities and allocate resources. So a structured decision-making process that explicitly define the options that will be considered, the decision factors, the criteria that will be used to compare them, and how they're going to be evaluated and balanced are really important for decision-making and make sure that this is the transparent process. And you can see here that it is also part and identified by FAO as part of the risk management framework. But organizing out of those factors can be quite difficult, and making it transparent is even more difficult. With that in mind, FAO has developed this guidance that we will be focusing for the rest of the talk. But I also wanted to highlight that there are other examples in the area of animal health, zoonotic diseases, that use similar approaches. And here is a CDC reference for you as well, if you are interested. So how do we go about prioritizing food safety issues? Well, first, and I want to mention this, we must look at the public health impact of those issues to have an idea about the ones that come first before we start considering and thinking about what are other factors beyond public health can impact the decisions. So let's first do that. It's something that must be done, looking at the public health and how that impacting all your considerations. And then once you have that understanding about your top issues, only take into consideration public health, you then can move on into prioritization, which again involves those 5 steps here. And you will see there's some references that have more than 5 steps, or but in overall, they are pretty much similar, and will give you the same idea. But I will go over each of them, explain them to you, provide an example, and hopefully by the end of this talk, you have a general understanding of how prioritization of food safety issues work. So the first step we're going to be talking and trying to define is what is the problem. As with risk assessment, the first thing you need to define is what you're trying to address, what you're trying to answer. It might be that you're trying to prioritize interventions to control a specific hazard or food combination. So for example, aflatoxin in maize, mercury in fish. You might want to have specific interventions that are available, and you want to select what is the top one or top three that you might want to consider out of, let's say, maybe 10 or so. You might also be looking at prioritize food safety issues. So understand out of the several hazard food pairs that can be a concern for your country, for your community, what the ones that should be prioritized. The second step is to identify the potential alternatives. And alternatives here in our context means what you're trying to select, what you're trying to identify as your top priorities. So for example, here are a few food safety issues. So the hazard and food pairs that you might be interested in identify which ones are the top ones of your concerns. Here I only have 4, but you in the real life situation, you might have 10 or more. And trying to identify which ones are your top priority can be a little bit more complicated. So you have an idea. Those food safety issues can be identified through data coming from your surveillance systems, concerns that you heard from stakeholders, media, trade, exporters. You might have also to interact with experts and even get data from the literature, information from the literature to come up with a list of food safety issues that are relevant to your country and make sense for you to evaluate. Another example of alternatives that you might be interested in prioritizing, as I mentioned, are interventions. And you go about the same way. You might have a food safety issue already established, let's say aflatoxin in maize, and you then will identify through literature, through experts, to a series of other sources, what are the existing interventions, potential interventions that could be considered to solve the issue of aflatoxin or reduce the risk of aflatoxin in maize. And that's what you're going to be. So identify alternatives is what you will be prioritizing. Step 3, it's selecting your decision criteria. What factors are relevant for your decision? Public health impacts, economic impacts, food safety, food security. Those are examples that I listed here, but it's really thinking about what are the factors, the criteria that impact a decision when making a decision, a policy decision that will influence. And you wanted to be able to quantify those criteria. Either it could be quantitative or qualitative, but you will need to have a metric for each of the criteria you select. So of course, we work in public health, so you want to be measuring, comparing your alternatives by what? Number of units, reduction, ability to reduction, the number of units that a particular intervention will reduce. Will that impact food safety, food security, for example? So thinking about those examples, those factors, and coming up with them and how you're going to measure them are very important. As with risk assessment, you want the best data available and you want to characterize uncertainty as much as possible. So in this slide, I have here an example of what those criteria might be and what the metrics. So if you choose a public health, for example, as one of your criteria, you might want to quantify that as using disability adjusted life years or DALYs, right? And here's a source that you could potentially use. Here's an example, as I mentioned to you. So same thing goes for international trade. And note that, as I mentioned, not your criteria need to be measured quantitatively. You might have some criterion that will be qualitative, like, for example, in this example, consumer perception. The fourth step is where you gather your evidence. So you will be, again, looking for the highest evidence, you know, as a famous saying, garbage in, garbage out. This is very important here as well. The data you choose to quantify your criteria across your alternatives are key here. So you develop this performance matrix where you have, in this case, a table with those point estimates for each of your alternatives here. Note again that you have a mix of quantitative and qualitative here. And when developing a word of advice, when they're developing qualitative metrics, it's very important that you try to characterize and describe that as much as possible. And tables can be quite helpful, you know, just low, medium, high. What do you mean by that? You know, try to, again, describe that to the best of your ability. It's also good practice to normalize qualitative and semi-quantitative scores before aggregating them. Finally, in step 5, we aggregate we bring all of those measures that we did for each of the criterion and for each of the alternatives all together to produce a single score. And that single score is then used to basically order your alternatives. And again, remember the alternatives here could be an intervention. In this case here, example that I have in the screen are parasites. So the hazards, the microbiological hazards here, food pairs. So you use the score to order your alternatives from high to low, and then you can see the ones on the top your top priority based on the criteria that you chose for that particular prioritization. So unfortunately, I have not a lot of time to go into how those aggregations are done. There are several methods here. In this particular example that you see, it's a linear additive model that is being used to pull all the data, all the scores together from all the criteria and produce this one normalized overall score. Again, this is an FAO prioritization effort done for parasites. In the next slide, I have a second example of another aggregative method called outranking. This is a multi-criteria decision analysis method, MCDA. And again, if you are interested in learning more about how those methods are all the equations and the mathematical assumptions and algorithms behind it, I suggest that you can email me. There's my email in the end of the presentation, but also there are some references in the slides that you see some of the references. You can also look there, but please email me. I will be happy to provide more information here. Another note that we didn't have time to go into is that for the different criterias, one can assign different weights. So when we've talked about public health, economic impact, consumer perception, not all of them need to be considered equally. You can put more weight on the public health, less emphasis on the economic, so they don't need to all be considered the same. Those are called weighing. But again, not enough time to go into that, but it's a feature of prioritization that you can also play around with and see how that changes your prioritization and your efforts. So lastly, just a few final thoughts here. Risk ranking and risk prioritization efforts are data intense, and data gaps that are not addressed adequately will generate unreliable outcomes. So I recommend uncertainty and sensitivity analysis. We haven't talked here, but they are very important, as probably was mentioned during the risk assessment as well. Qualitative approaches, they can be a start, but they are not a solution for lack of data. So just keep that in mind as you do your effort, and always strive to achieve the best information, obtain the best information you can. In practice, risk prioritization, is done using multiple factors, not only public health. So the effort here is to be more transparent and gather evidence so you can better your decisions around those other factors beyond public health. So that will result in a more rigorous and transparent decision-making process, and even help gather more information for the future. So with that, I know this was very fast, but please reach out if you have any questions. I'll be happy to provide you some more information. Thank you again for this opportunity.
Thank you, Juliana, for sharing your step-by-step approach to risk prioritization. Our food safety challenges are obviously very complex, and so these data-driven approaches really help us make strategic investments and decisions that truly have the greatest public health impact. I'd like to invite all of our panelists to the screen, so please turn on your videos, and we continue to encourage participants to add your questions to the Q&A. If I might, we've heard 3 fantastic presentations based on risk assessment approaches, and I'd like to ask my first question to Dr. Ari Havalar. So in a sentence or two, Ari, what is your sales pitch for using risk assessment, or why should participants use risk-based approaches?
Thank you, Haley. That's a great question. In one sentence, I could say, is there an alternative? I think maybe also listening to Joanna and Juliana, you see that it's the standard approach chosen by Codex Alimentarius, WHO, FAO, national governments like the US government. But I think it's also more from a technical perspective, it's a way to order a lot of complex information in a consistent way. Yeah. And when you can quantify, if you have the data, the resources to quantify, you can then evaluate the impact of interventions before you actually implement them in practice. So that saves a lot of money, a lot of effort, and also may help to resolve differences in opinion between stakeholders. I mean, typically you can prevent or make food safer at primary production, during processing, at the consumer level, and different stakeholders will have different preferences. A risk assessment is a great way to evaluate the effectiveness of reducing the consumer risk, and when you combine them with economic models, like for example FSAS also does, you can also look at the efficiency. How do you get the biggest bang for the buck? So I think risk assessment is just a very powerful way of ordering a lot of complex information, ultimately leading to decision support that is essential for risk managers.
Yeah, I think you make a great point, Ari, with when we have to make a decision or if we need to resolve differences, data-driven is always a logical approach to that. So, but thank you for that response. If I might ask Dr. Zablotsky-Kufel a question, FSIS is a great example of how to incorporate risk assessment frameworks into a regulatory situation. What advice do you have for other countries or institutions who are interested in this approach but don't know quite where to begin?
Yeah, I mean, I think one of the themes that we've been hearing all along is that you need data. You need data to be able to do any of this work, and you need robust data. There are some shortcuts, obviously, and some analyses that can be done to get around that, but for the most part, that is what that's the underpinning of your analysis. So, I mean, I would encourage, I guess what I would encourage is that first focusing on their surveillance systems and the different industries that produce data and the regulatory agencies that produce data, and finding a way to collate those things, I guess you could say, so that you can use them in a meaningful way. it's the other thing I think is important, and I've noticed this amongst ourselves, but also amongst the other food safety agencies, CDC and FDA particularly, is a real interest and focus on the science and the data, and really validating that point with others and showing the benefit of using something that is robust, such as risk assessment, and can be defended in many different ways for your decision making. If you've got a solid risk assessment that's been peer reviewed and all the rest behind your decision, it's kind of hard to argue that policy A is worse than policy B or something like that. So valuing the science and valuing the data, I think, is certainly the first step, and promoting those things amongst agencies and others in the government.
I think you highlight an important piece of this, and it's really partnerships, and that's across agencies, and then where do these data come from? And the outcome of risk assessments are only as good as the data. And I can speak from personal experience in my earlier career here at Purdue, contributing some listeria work in retail to risk assessments. It's an important part of what I do here as a faculty member, but it really was doing our best to populate models with quality data so that the best decisions could be made from that. So I certainly appreciate the complexity of it, but how important those partnerships are as well. If I might ask Dr. Ruzzante a question, you mentioned a lot of external factors that impact decision making in food safety risk management. Who do you want on your team during this process? So at what stage do you include stakeholders, and what stakeholders would you include?
Yeah, thanks for your question. I do believe that who will be part of your team will vary with who, what is the topic, what you were actually trying to achieve, right? So the first stage of what you're trying to define, what you're trying to do, are you trying to select interventions, are you trying to prioritize interventions, are you trying to look at the hazards and the foods, in a country that you want to try to focus and prioritize. But I would say, as a general rule, I would say if you're going to try to focus on selecting a range of interventions and prioritizing those for a particular issue, you definitely would like to bring in industry representatives and consumer representatives sooner rather than later, I would say. And I see Joanna shaking her head, and I think it's a very complex and can be very messy process, but will save you time down the line, honestly. So it is also part of the risk communication approach of risk analysis. So and it comes handy here. But as far as you beyond those stakeholders, folks from academia, experts that are in the field might be also very helpful on working on that. And keep in mind, and we are here food safety experts, public health experts, but as we branch out into those areas of economics, nutrition, for example, social scientists, you might need to bring in those expertise, within your team, right? That's outside of most of our training and expertise. So that's something to consider. And as if you're in a government, you might be able to also contact someone in a different office, in a different agency, I would say, that might have a share or a stake on the work you've been doing. So that's sort of a general answer, but sort of the starting point.
No, certainly. And if I might hold you on the mic there with a second question from our Q&A, Juliana. Taking a data-driven decision, making a data-driven decision can be difficult for some smaller micro entrepreneurs, but safeguarding public health, of course, is in everyone's interest. So what decisions or steps could you suggest for smaller operations that are really interested in doing the right thing of protecting public health?
And I think that I saw that question, I answer, and I think actually is a great question for all of us to address honestly. But from where I stand, I see one of the things that Ari mentioned as he advocate for risk assessment is even as a small entity, trying to realize and identify what are the factors that are influencing your decision, even as a mental exercise, if you will, would be important. This way you can understand, how your decisions are being impacted. And it's definitely challenging. I'm not going to say, Joanna mentioned, Ari mentioned, you need data. You will have that as a barrier, and sometimes some qualitative approaches might not give you the answer I'm not going to say you wanted, but not the best robust approach here. So I think it's a tough one, to be completely honest. I'm interested on Ari and Joanna. I hope I potentially some help from researchers in your area. It could be a way to partner with others to maybe help strengthen and enable small and entrepreneurs to advocate for that. But Ari and Joanna, I don't know if you have thoughts on that.
Feel free if there's other comments that you'd like to contribute to that response. If not, I do have a question for Ari, and it was really if you could elaborate on the point you made about the importance of localizing partnerships. I believe you said, decolonizing science and knowledge. Can you explain how that is important for risk assessment?
Yeah, I think that's a very important question. There is a lot of discussion ongoing about fair collaborations, fairness in North-South collaborations in particular. UF has a whole series on helicopter science, decolonizing science, where we look at it from different angles. So one perspective is just the ethical part of collaborating on an equal basis, realizing that there's a lot of power differences between high income and low income country based organizations. So that's one part, is just fairness and equity. Looking at more at it from a technical perspective, what I'm finding in discussions with my partners, mainly in Ethiopia, is that to really understand what the data that you are collecting, I would say, what are the mechanisms behind the data that you're collecting, you really need to empower the local investigators to explain to you the system, the cultural norms, the way food is produced, food is eaten, and the very complex patterns around it. Some of the work we're doing related to early colonization of children, infants with Campylobacter. We find food-related factors like early start of complementary feeding, providing raw milk, food security in general are risk factors. And to really understand what drives that, but certainly to understand how you could reduce those risks, how you could address those risk factors, you need a very deep understanding of the local culture. So I think the only way forward to make food safer in countries is to engage the local researchers, the local communities, not only in executing, for example, the data collection part, maybe training them in the lab, but getting them involved from day one, where you start designing a project, start thinking about the project, because then the project will probably be much more relevant for the country, but there's also a much higher likelihood that the results will be taken up and sustainable. Yeah. I hope that answers the question.
I think it does. Thank you, Ari. I know Dr. Roussante may need to step away, but we have two final questions that I think our panel will be able to, shed some light on, kind of in the same vein. Ari, Dr. Dick Tinsley asked a completely reasonable question about the cost of these approaches. Who typically bears the cost of these types of assessments, and does the cost get passed to consumers who may not be able to afford these additional costs? Is that, the question being, who typically bears the cost of either the decisions or the assessments themselves? Dr. Zablotsky-Kufel, also from the FSIS perspective, perhaps you could comment on the similar, in the United States structure, obviously this would be probably taxpayer funded, but if you could comment really on how FSIS views, the cost of the approach and how those costs are borne out over time.
Yeah, as you said, we're funded by taxpayer dollars, so we are responsible for doing our very best to respect that and make sure that we're using our resources wisely, and our time and our energy, and our field staff and our scientists and so on and so forth. I think the thing too that's important to know here with regulatory decision making, it's not just based on the science. There's a whole cost benefit side. Cost benefit analysis that has to happen as well if you're introducing new rules or want to introduce new rules. And so what the risk assessment produces are the benefits, like what kind of public health impact. But then the economists who in my group work in the Office of Policy take the data or the outputs that we produce about the benefits and figure out what it costs to do the things, the different scenarios that are that we created through the risk assessment. And, we can't, as an agency, unduly burden the industry with new interventions or new responsibilities or new regulations that, would bankrupt the industry. That's not, it's not okay. And it's not okay for us to do, but it's also not, legal may be too strong a word, but it's not something we can do as a regulatory agency. So we are really trying to make sure that we're the balance here is benefiting the public and public's health, but also recognizing that there are costs to the industry to implement these things and that we have to be respectful. And we don't want to bankrupt industries, obviously, because they're an important resource and they produce food for the entire world, let alone this country. So it's definitely a balancing act.
Certainly. I think it's a good demonstration of the interface of food safety and food security. That we have to truly take not only a risk but a cost-benefit analysis approach to finding that sweet spot or optimizing food safety and public health. Well, I think at this point I would like to thank our panelists for joining and for their presentations to discuss risk assessment, risk ranking, prioritization, and how we can use these tools to really drive forward food safety around the globe. I'd like, for those of you who have joined us online or see this presentation in the future, feel free to contact us at the email address for the Food Safety Innovation Lab that's posted on the screen. And we encourage you to join us next week as we continue this conversation on risk-based approaches for food safety. So if you're interested in risk-based approaches in food safety or have related research to share, we would like to hear from you to understand the country's value chains and market sectors where there's enthusiasm for this approach. So again, please feel free to reach out to us at the Food Safety Innovation Lab email. We also hope you'll join us 1 week from today for the next webinar, Applying Risk-Based Approaches. So how is this applied and actually done in the field in food safety? The registration link for next week's webinar can be found in the chat. So thank you again to our presenters. We appreciate your expertise and thanks for joining us, everyone online. Have a great rest of the day.